So as usual, we're just going to wait for people to join, a lot more people. Yeah, so we can just start. Today is not going to be like a really long live video. Um, it's going to be most likely between 10 to 15 minutes. So it's not going to be like a regular 45 minutes to 1 hour. So yeah. Hi, good evening, welcome. Welcome. So you guys should just start preparing all your fertility questions. Start writing them down because I'm just going to give a brief talk on IVF. Today I'm just going to focus on IVF, tell you everything you need to know about IVF. I'm going to summarize it because I already have a video on my channel. So I even have like a playlist. I have like a playlist of everything you need to know about IVF. So you can just, after this video, go and watch it if you don't like, because I'm going to summarize. So welcome, 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 all of you. Welcome. Let me just start because I don't want today's streaming to be long. So if you have questions, just start dropping them now. Hi guys, if you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility physician and my channel focuses on everything and anything women's health and fertility. So if you like this kind of content, you want to know more about the female body, you want to know more about fertility, about your journey, your trying to conceive journey, please subscribe to my channel and let's get right to today's show. So today I'm going to be talking about IVF. What is IVF? IVF is simply an assisted reproductive technology that assists, apparently because of the word assisted, that assists couples that are finding it difficult to conceive naturally, to conceive. So a lot of people that that are subscribed to my channel, well, not a lot, but a lot, are currently on their journey to conceiving. And today I'm just picking this topic IVF because some people don't even know that that is an option. And it's a okay, yeah, the questions are already coming in. Keep it coming, guys. Okay, so it's an option, yeah. So what happens is the conception is assisted. We use technology. We take out the woman's egg, we take the man's sperm, we fertilize it outside of the body, and then we transfer the resultant embryo into the woman, into her womb. So the idea is the woman, the couple comes to the clinic for consultation. Maybe they've tried to conceive for over 1 year and they were not successful, so they come to the clinic. They want to know, okay, what the options are, and one of the options, which is IVF, we counsel them and tell them, okay, this is after doing like investigation, series of standard infertility tests, we take proper history from both couples. We then tell them if IVF is a good fit for them. So when is IVF a good fit for someone? Maybe maybe there's a sperm factor, like the man has his sperm analysis is not optimal, or there is female factor, which can be either tubal factor, that is you have your fallopian tubes blocked, or you have a disease of the ovary, a disorder of the ovary, which could be like a complication of endometriosis, or you have, it could range from even fibroids to, you know, any disorder that can actually prevent a woman from conceiving, that can actually affect fertility. So what we do is we just majorly check, we try to check, for any possible cause of infertility. And then even if there's nothing found after all of these tests for both the man and the woman, and then we diagnose you with unexplained infertility, yeah, you can still do IVF. And yeah, some people, IVF is not 100% successful. Some people do it once and then they get pregnant. Some other people have to do it multiple times, have to come back again and again and again before they actually get successful. And my advice is that, okay, you try the first time, it doesn't work, don't give up. If you have the money, keep trying, because sometimes, even though research has not shown the reason why some women have like successful implantation and others don't, you know research also shows that by the third IVF cycle, the chances of getting pregnant increases. So don't give up, just keep trying. Sometimes it just requires an extra investigation to check for something, you know, and if you give up too fast, you might not actually get to that point where we find out, okay, why there has been no implantation. And so IVF takes about an average of 28 days. So you're ready to do IVF. Just, know that it can take as long as 28 days for the whole procedure to be done. So you have to like prepare yourself mentally. The woman, okay, because it's a procedure where the steps is that we start giving you medications as the woman to stimulate your ovary to produce a lot of follicles, and these follicles are what like the eggs are swimming inside. So what we do is, when the follicles have grown big enough, they're mature enough for us to collect the eggs, we give you a medication trigger trigger the release of these eggs. So on the day of collection, we call it egg collection or ovum pickup. It's usually a 30 minutes procedure, about a 20 to 40 minutes procedure. And then it's not painful because we put you under anesthesia. So we retrieve these eggs. And after retrieving the eggs, that same day, your partner, your male partner, or a donor sperm, that's a younger man with a good sperm analysis, will give us his sperm, and then the eggs we've gotten, the embryologist will then take the sperm, put it in the same dish as the egg so that the sperm can fertilize the egg, and then we put it in an incubator. So the incubator is like a machine that mimics the natural environment of the womb. Then after about 3 to 5 days, we take this embryo and then we transfer back into the woman, or we transfer into the woman. Yeah, so IVF is as simple as it sounds. It just sounds like, oh my God, it's not just to take my egg, take my partner's sperm, fertilize it, and transfer the embryo inside me. Why am I not getting pregnant? Well, unfortunately, or should I say, well, it's unfortunately because people spend a lot of money, and then sometimes when it's not positive, it can be really heartbreaking. But yeah, research has not really found out the reason why not everybody has a successful IVF cycle. But this is an option. This is an option that everyone trying to conceive should be aware of. So you don't think that your chances are limited or your options are limited to certain types of, methods. Yeah, so IVF is not painful. Transfer is like 10 to 15 minutes. That's if it even takes up to 15 minutes, and it's a very painless procedure. It's just really simple. Most women ask like, are we done already? And it's just like this. It's so fast. Yeah, so what is the success rate? Success rate depends on the age of the woman, also depends on the history, the medical history of both the man and the woman. So it differs, but in total, it's not up to 60% successful. So yeah, and it can be as low as 20 something percent successful, depending on the age and the history of the couple. Yeah, so Somebody asked, okay, so I'm just going to start answering the questions now. Someone, let me do the questions. Someone asked, can infection delay pregnancy? The answer is yes and no. The answer is yes and no. So I'm going to tell you the reason why I said no first before I tell you the reason I'm saying yes. So the yes, no, because when a woman has infection, it depends on the type of infection. Are we talking about sexually transmitted infections? Are we talking about candidiasis? Are we talking about bacterial vaginosis? You know, it depends on the type of infection. So if you have like bacterial vaginosis, candidiasis, you know, all the woman needs to do is treat this infection and she can get pregnant if there's nothing else that is going to impede, you know, conception. So yeah, and for some sexually transmitted infections like syphilis, gonorrhea, trichomoniasis, you know, those kind of infections, when treated properly, does not necessarily have to, you know, does not necessarily have to affect fertility, because I mean you've treated it and then there's nothing that is going to impede conception. So, but why I said yes, it can is because in cases where, because some of these sexually transmitted infections, like, you know, syphilis, gonorrhea, trichomoniasis, you know, sometimes the when you have it, it's asymptomatic, meaning that you're not experiencing any symptoms, no itching, no smell, no abnormal smell, no abnormal discharge, you know, no symptom at all. And then some women can go, you know, months, years without even treating this thing, and it can actually lead to what we call a pelvic inflammatory disease. And you know, at some point, obviously you don't remain like completely asymptomatic for years. So at some point, even when, you know, some women start to experience some symptoms, they just ignore it, and you know, they just think, oh, it's normal candidiasis and whatnot, and then they ignore it, and then, you know, they keep having sexual intercourse. And when you have sexual intercourse and and you already have these infections, you keep, you know, pushing, because what the penis does, it keeps pushing the infection upper and upper. That's, the infection keeps ascending and it goes up all the way in your womb into your fallopian tube, and can cause damages, it can cause irritations there, it can cause scarring, like wound scars. And when it does that, it closes up that place and prevents sperm from actually getting to the egg for fertilization, and can also, even if it's not completely closed up, and the sperm can find its way into the tube, it might prevent the, if the sperm actually gets to the egg and fertilizes the egg, it can prevent the embryo, that's the fertilized egg, from traveling back into the womb where it's supposed to implant and grow. And that can cause what we call an ectopic pregnancy, meaning that the embryo is implanting in the tube and then it's growing in the tube. And you know, the tube, the way nature is, like, the tube is not made to carry a baby. So by the time it gets like 6 weeks, 7 weeks, 9 weeks, you know, it has grown big enough that the tube can no longer manage it there, and then it can rupture, and this is usually life threatening. Also, when you leave infection like untreated, regardless of whether you keep having sexual intercourse, the infection can get complicated when not treated, and can still ascend, you know, and can ascend and still affect the tubes, the fallopian tubes, and, you know, it can just cause like a mess in the reproductive tract and prevent sperm from actually getting to the egg for fertilization. And you know how pregnancy works now. You know, the sperm has to actually meet that egg for a baby to form. Whether or not it's you're doing it naturally or artificially, no matter how you're doing, a sperm has to meet an egg for pregnancy to occur. Yeah, so yes, fertility can delay pregnancy if it has been complicated by what we call a pelvic inflammatory disease, which is popularly known as PID. Yes, it can do that. But this is not to say that when a woman has infection, therefore that's the reason she's not getting pregnant. No, 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 no. That's not the reason. I have a whole video anyway on, in fact, I have like 2 to 3 videos on how vaginal discharge and infections can affect fertility. And I did a whole like drawing and visual representation of how this can happen. So after this live streaming, you can just, check out the video and watch it. So let me just check for another question. Is breast discharge a sign of infertility? Okay, so breast discharge is, well, it depends. So when some women have like breast discharge and they are not breastfeeding, yeah, it could be that the prolactin, that's the breast milk hormone, is so much in the body that is causing the discharge. And when that prolactin is, hyper in the blood, it can affect, it can prevent ovulation. And you know that ovulation simply means that a mature egg is being released on a particular day of a woman's cycle from her ovary. So ovulation just means this mature egg is being released from the ovary into the fallopian tube, waiting for a sperm to come and fertilize it. So if that particular process does not happen, if that egg doesn't get to the fallopian tube, even when you're having sexual intercourse, there's no egg for the sperm to fertilize. So yes, when you're having breast discharge, you need to see a doctor. You need to see your family physician or your gynecologist, or your endocrinologist. You need to see your doctor because you need to know what is the cause of this breast discharge. There are several causes of breast discharge. It could be a tumor in the brain, it could be anything. You want to get that treated first. You want to get that treated first before you attempt getting pregnant. So I hope I've been able to answer that particular question. How much does IVF cost in Nigeria? So thankfully, I have done a whole video on this because it's really hard to tell you how much IVF costs without you understanding that there are different types of IVF. There's the one where you use a donor cycle. Then there's the one where you use own cycle. What do I mean by that? There are some women, or there's some women that don't have enough eggs in their ovaries, or for whatever other reason we decide that okay, a donor egg is best for you. Then we get a younger female, we stimulate that younger female to produce eggs, and then we use the woman, that's the patient's, the client's partner's sperm, and we fertilize the donor's egg and then transfer the embryo into the client's womb. And then in a case where the man is not producing sperm cells, or the man's semen analysis result is not favorable, is not satisfactory, we might decide to use a younger man, and then we on the day we are collecting the egg from the woman or from the donor, we would use the younger man's sperm and for the fertilization, and then transfer the resultant embryo into the client's womb. So in cases like that, we have prices for donor egg, we have prices for donor sperm, we have prices, costs rather, not prices. We have costs of using your own egg and the man's sperm. We have cost for surrogacy, we have cost for donor backup. So what donor backup means is that you are stimulating yourself but also stimulating a younger person. This is because in case you don't respond to stimulation, you can just quickly take the donor's egg and continue the process, the treatment cycle. So all of these have different costs. So I would, when I after this live, I'll upload this video and then I will put the link to the cost of IVF below. Yeah, but you should, for you to just have an overview, an idea of how much IVF could cost, it's between 700,000 and 5 million naira actually. But for the breakdown, you could just check my video, because sometimes some hospitals do promo. That's when they go as low as 700,000, because without promo you probably won't get any IVF for 700,000. Yeah, it's a bit expensive. Yeah, but is it worth it? Yes, it is. It's worth the try. So um how long is an entire IVF cycle? Yeah, I've said it's an average of 28 days. You know, the first 14 days, an average of 14 days for stimulation, for stimulating the woman. Then after stimulation, you have like 2 days. Then you do the egg retrieval 1 day, and then transfer is usually 3 days after the egg retrieval or 5 days after the egg retrieval, and then pregnancy test is 2 weeks after that. So if you're looking to do IVF, just know that 1 whole month, prepare 1 whole month for the whole process. Sometimes it could be more than 1 month, or depending on your pre. In fact, okay, yeah, the IVF cycle itself give an average of 28 days, but you should also know that that one is besides the normal consultation, because before we even start your IVF cycle, we have to do investigations, you know. So that one is a different. You don't need to take like um um well, that one is something that it's not like you're going to be coming to the hospital too often, but we'll be giving you like, you know, appointments, so that we can follow you up and, you know, find out, do the necessary investigations. um Let me see. How many weeks does a couple need to stay in Nigeria for the IVF procedure? How many weeks do you need to stay in Nigeria? So what I tell my patients is, if you're not in the country and you want to come to the country to do IVF, please just tell yourself 3 months. And this is because initially I used to like try to time it so well, you know, tell them to do some investigations over there. For people that have like very limited time, I'll be like, okay, do some investigations over there, send me the results, we'll do virtual consultations, you know, talk on video calls and all of these things. Then when I feel like we've done all the necessary investigations and it's just time for the cycle itself, then I tell them this is when you should book your flight, come, we'll do it in the space of this month and this so and so weeks rather. Then you can go back and even do your pregnancy test over there, you know, make it really easy for patients. But with time, I realized that, okay, yes, it works, but then it puts so much pressure on both the doctor and the patient. And I'm like, okay, even if it's 2 months you will spare to come to the country, please try and spare 2 months, so that we can, I mean, we have ample time to do all of the right things. So nobody is rushing anybody, nobody is under pressure, nobody is, you know, it's better if you're coming to Nigeria to do your IVF. Please, if you can spare 3 months, spare 3 months. If you can't, 2 months. But don't just come without contacting the hospital. Contact the hospital. You people should plan it together. You see your flight dates, your leave, everything, plan it with your doctor, because I've had a couple that did not plan it, just showed up in the country, you know, and was expecting things to just, you know, work within the space of time given to us. Well, it's usually not really advisable, to be honest with you. So if you have a hospital in mind, make sure you start communicating with the hospital much before you come. Everything you're gonna do, you have to plan it with your doctor till the date of your flight. You have to plan it with your doctor, so that everything goes smoothly and well. Okay. And I'm saying this because sometimes there are some investigations that, you know, we might want to redo. You know, there's some investigations that we might just, you know, maybe when you come, we do our own examination, and we realize that, man, we don't want to go on until you do these tests. And then if you're looking at, oh, your flight is this day, we will now be like, let's not do this test, oh, there's no time. No, 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 no. Don't put any doctor in that kind of situation, because in the end we want results, right? So you're coming to Nigeria to do your IVF. Please, please, please make out like 3 months. If you can't, 2 months is okay. 2 months that you well planned with your doctor. Good evening, everyone. I'm seeing your greetings. I'm seeing it all, because I decided I won't be calling names when I'm reading out questions. So yeah, but I can see you guys. um how many weeks does a couple need to stay in Nigeria for the IVF procedure? Okay, I've answered that one now. How common is erectile dysfunction during TTC? Well, funny enough, I've not really like had so much cases of erectile dysfunction, but it doesn't really matter. Erectile dysfunction does not necessarily mean you cannot use your sperm for IVF. See, that's the beauty of IVF. That's the beauty. It gives everybody a chance. Yes, your erectile dysfunction, by the time we probably can extract sperm from you, we might not have quality sperm, but then it depends on how many sperm cells we see, because you don't need to have the normal limit, the normal amount of sperm count. You don't need to have the best moving sperm cells to do IVF. As far as we can see sperm, you have a chance of using your sperm cells. Yes, we would advise for a donor backup, in cases of extreme sub optimal sperm analysis, but then we can still try to use your sperm. I've seen, cases of success, IVF success with a sperm analysis that was not so great, because we do something called ICSI. So this also takes me back to the person that asked cost of IVF. I mean, ICSI is another type of IVF, intracytoplasmic sperm injection. So that one even has an extra cost on its own, but it's not like extra cost. It's just really between 100 to 100 and to probably 200,000 naira, that you pay extra when you want to do ICSI. So ICSI gives you a chance to actually use your sperm for IVF. So yes, it depends. Erectile dysfunction doesn't necessarily mean that you cannot do IVF. But if you're asking if erectile dysfunction can affect you conceiving, yes, it can, because for you to conceive naturally, then you have to be able to have sexual intercourse with your partner. And if you have erectile dysfunction, then it means that you can't maintain an erection enough to have sexual intercourse with your partner. So that's the way it can affect fertility when you're naturally trying to get pregnant. Okay. Is it possible to unblock a blocked fallopian tube? That's a good question, because when you have blocked fallopian tubes, most patients don't want to hear, the management from a fertility doctor, because they would rather flush the tube. So I'm sure some of you have heard the word, I want to flush my tubes. It's blocked, and then they're going to put like fluid and then flush it out and to unblock it so I can get pregnant. That procedure of flushing is actually called hydrotubation. So hydrotubation is a procedure used to unblock tubes, temporarily unblock tubes in the olden days. Why am I saying in the olden days? Because with time, research showed that it wasn't really, really, really like giving results, because you flush your tubes and then it's blocks again. You flush again, you block. How many times do you want to keep flushing? And how many people eventually got pregnant after flushing? The statistics is pretty low. I don't have that off the top of my head, but the statistics was really low, that it was, it became obsolete. Nobody, no doctor. Well, a few doctors in some part of the world still do it, but then you find out that they are really much older doctors, because the management for blocked tubes, well, it's actually, I know you don't want to hear this, but it's actually surgical removal of the tubes or surgical ligation. That's you tie the tubes because oh, sorry, that's not what it is. That's not what it is. The the treatment per se, because if you want to treat blocked tubes, it's not like you're having abdominal pain or you're having bloatedness or anything. So when anybody is having a problem with the blocked tubes and they come to the doctor, it's because they are finding it difficult to conceive. Yeah. So for people like that, then the advice is to do IVF, in vitro fertilization, actually. That is the advice for people with blocked tubes, not flushing your tubes, not hydrotubation, IVF. So the part where I was saying the management is surgical removal is for people that have water in their tubes. So there's some people that have what we call hydrosalpinx, water fluid in the tubes. Those people, because the fluid is in the tubes, it sometimes swims into the space, the womb, where the embryo is supposed to, where the baby is supposed to lie. So then you notice that people like that too, they try to conceive, but it's not successful. So most times they want to flush out the water. Yes, these are the set of people that the management, the management is actually to surgically remove the tubes or surgically ligate, that's tie the edge of the fallopian tubes. Why you are doing this is to prevent that water from getting into the womb. This is the reason, because even when we are doing IVF for you, by the time we transfer an embryo inside your womb, if there's water there, it makes it very difficult for the embryo to find a place to implant because of the water. So it's just hanging in the air and might subsequently get flushed out. So the advice is usually to surgically remove the tubes or surgically tie the tubes so that you prevent the fluid from getting into the tubes. But for people with blocked tubes, my advice is do in vitro fertilization because according to studies, hydrotubation doesn't necessarily work and it's been outdated. And please stay clear of people, social media people that will tell you that they have drugs to help you unblock your tubes. Stay clear of them. Or if you must, ask them, how is this drug going to work? How will it go and unblock my tubes? Because I would really like to know that, apparently. Okay, can one get your number or contact? Oh, okay, please send me a mail. I know that sometimes it takes me long to reply mails, but I eventually do at some point. It might just take longer than it's supposed to. I'm so sorry about that because I'm kind of like really, what's the word? My schedule. I don't have a PA yet, so maybe when YouTube starts paying me, I'll have a PA and answer questions faster. But yes, I do reply my mails, but it might take longer than it should. But if you feel like I have ignored your mail, please can you resend the mail and I will try to respond to all the backlog of mails this week. Good evening, please. Is it good to take sunflower seeds, flax seeds, clove to regulate hormones? Well, all I know about natural products is that they are good for the body, they're good for the health. You know, as far as you're not taking all those herbal things from woods and those herbal concussions, you're good to go if you're taking your fruits, your vegetables, your seeds, like, you know, your nuts. And once you're natural, you know, they're like natural supplements. Yes, good for you. Anything that is good for your body, that is good for your general health, is good for your womb as well, and is good for your trying to conceive. So if you're on all of those natural things, good for you, keep it up, because some of these natural nuts and all those things are really high in folic acid, which is very is a supplement that is extremely important when you're trying to get pregnant, because it helps to reduce, a birth defect called neural tube defect. So yes, good job, guys, keep it up. um Tips for having a successful first trimester. Oh, I love this question. This means that there's a positive pregnancy, and you're looking for tips for a successful first trimester. Congratulations, I love this kind of news. Anyway, yeah, tips for a successful first trimester. Don't be sedentary, move around, not too much apparently, but rest as much as you can, but also take walks in your estate or your streets, and eat fruits, vegetables, drink a lot of water, because naturally pregnancy, what it does, it's kind of like causes constipation, so, and when you have constipation and you're finding it hard to poop, it can if you're finding it difficult to poop, you are putting strain on your lower abdomen, on your uterus, on your womb, and it can lead to miscarriage and all of that. So we advise pregnant women to drink a lot of water to prevent constipation. Yeah, and then eat fruits, eat healthy, have peace of mind, maintain a positive mindset throughout your pregnancy. And if you notice any change in your body that you are not, you know, familiar with, they've not told you anything about in the hospital, please, please, please go see your doctor immediately so it's not too late. If you see any blood stain, don't assume it's your period. Please go and see your doctor. Whether you have pain with the blood stain or not, go and see your doctor immediately. Yeah. So someone said, "Good job, Dr. Amarachi. Thank you so much. Thank you. Thanks for even tuning in to the live today." Does the presence of a coil slash implant increase the risk of miscarriage later on? Now, this is a kind of like a dicey, a really dicey topic. Well, coil doesn't increase the risk of a miscarriage later on. The studies are not conclusive on this one. It's not conclusive on this one. So I can't, there's no like strong evidence for that, and I don't want to like scare women that are trying to get contraceptives with studies that are not concluded. So I probably will not answer this question this night. Yeah, so let me see. How long can a couple stay in Nigeria after IVF? You can go back to your country almost immediately, even before the pregnancy test, even though it's not really advisable. But I mean, you can. A lot of my patients have done that, and it did not affect their results. Yeah, so you can go back to your country and do your pregnancy test there, Seth. You don't even have to wait to do the pregnancy test here. And immediately you see your pregnancy test, you can also still fly, even though as much as possible we advise you to stay back if you can. But I mean, you have a job. It's the job that you is the uh, revenue or salary from your job that you use to get your pay for your IVF. You can't possibly leave that. So if you necessarily have to go back to your country immediately, yes, you can. It's possible. But we'll tell you what time in your pregnancy you cannot fly and what time you can fly. So but after IVF, yes, you can go back to your country. The main thing is when you go back to your country, just maintain all the guidelines, eat right. I can't stress on, I can't overemphasize. I think this cannot be overemphasized, yeah. So let me see if there are more questions. Um, we have sent the mail to you. Okay, no problem. I'll check the mail right after this live show. Okay, I'm not pregnant. Oh, okay. The person that asked about the first trimester said, "I'm not pregnant. I will be planning pregnancy soon, but want to prepare in advance. But love the baby dust coming my way. Yay! Is it normal to get constipated during the luteal phase? Yeah, for some people, yes. For some people, yes. They do get constipated, but it's not something that is general. It doesn't happen to everybody. But yes, some women have reported that they feel constipated, bloated, during the luteal phase. Yes. So, so that's the last question for now. And even though I said I was going to spend 10 to 15 minutes on this live show today, this is 40 minutes, and 40 minutes well spent with all of you. And I can't wait to do this next week as well. So you guys should just keep keeping your questions, piling them up. I'm going to answer every single question. So I hope you've loved and enjoyed and found today's live show informative. See you in my next video. Good night.